Hi everyone, this is Dr. Launice and I take care of sick babies for a living, and I like to talk to parents, guardians, and family members about what to expect when the unexpected happens and your baby is admitted to the NICU. So last week I did a video talking about what happens when babies have low blood sugar, so please go and check it out. But this week I would like to talk to you about something called apnea. So what is apnea? Apnea is when a baby has a pause in their breathing for 20 seconds or more. Now, some babies may have pauses of 5, 10, or even 15 seconds, where they can breathe really fast and then take a pause, or breathe really fast and then take a pause, and this can be normal. But if a baby has no breaths in 20 seconds or more, then this is what we call apnea. Apnea can be broken down into two main categories, one being central apnea and the other being obstructive apnea. So with central apnea, basically what we're talking about is the baby in the brain has a breathing center, and that sends out a trigger that goes to the baby's breathing muscles and triggers the baby in the diaphragm to breathe, take a deep breath in, and then breathe in and out. If anything interrupts this process, or this process is immature, then the baby doesn't get that trigger to breathe, and we call it central apnea. For obstructive apnea, baby is actually breathing and taking in these breaths, but there may be something structural or anatomical in the baby's airway or throat that's blocking that flow of air from coming in and getting into the lungs. So there's also a third category, which we call mixed, which actually contains a component of both central and obstructive apnea. So what causes it? This is something that we see very commonly in babies who are born prematurely. It's very common in babies born 34 weeks and below, but even in babies who are born between 35 and 37 weeks, which we call our late preterm babies, they can present this way as well. And again, it's because this breathing reflex is immature. When the baby is inside mom in the uterus, they're not really using their lungs to breathe, right? When we breathe, we take in oxygen and we blow off CO2. And basically, when the baby is inside mom, the placenta does this function for the baby. So the placenta is acting as the lungs. So after delivery, the baby then has to take over this reflex and get this trigger from the breathing center in the brain that goes out and triggers the baby to breathe in and out. So sometimes when they're born early, this process is a little bit immature. We can also see this in babies who are full term, but maybe their dates are off or they're behaving a little bit more prematurely and acting as a baby who is a little bit earlier in gestation, and so we can see it in this case as well. Other causes might be if mom has been treated with any medications during the labor process. So mom, if they tell you that your blood pressure is elevated or they diagnose you with preeclampsia, the way that they treat that is they give you a medication called magnesium sulfate, and we know that this can affect breathing in babies. Also, if they have difficulty getting your pain under control and they give you an opiate or a pain med, we know that this can affect the baby's breathing as well, and sometimes after delivery they can have apnea. Other reasons that a baby might present with apnea is infection. One might be if it's a stressful, traumatic delivery and the baby needs a lot of resuscitation or help with their breathing and heart rate at delivery. Sometimes after this, they can also have pauses in their breathing. If there's a large bleed in the brain, if there's buildup of acid in the blood, which leads to metabolic disorders or is related to metabolic disorders, we know this can happen. And again, like I mentioned, if there's any sort of anatomical issues in the airway, for example, if baby's jaw is small or the tongue is very large, or if there's anything that's blocking the nasal passages. And the reason is we call babies preferential nose breathers. We know that we can breathe in through our nose or in through our mouth, but babies prefer to breathe in using their nose. So if anything is blocking the nasal passages, then it's going to cause them to have difficulty breathing. And if the muscles in the airway or in the throat are floppy as well, then that can sort of block the flow of air that comes in through the nose and then goes into the lungs. So what do we see in babies? We see this pause in breathing. We can see a drop in their oxygen saturation. We can see a drop in their heart rate, and sometimes they may be pale or look blue in the face and around the lips, and we call this cyanosis. So what do we do? First thing that we want to do is stimulate the baby when this happens. So we'll either rub the back or the arm or the shoulder. We may flick the baby's feet to sort of stimulate the baby to breathe. If the baby's not responding, the heart rate is low, the baby is not breathing, then you may see us put a mask over the baby's nose and mouth that's attached to a bag, and you may see us squeezing that bag, and that basically helps to give breath to the baby to sort of stimulate breathing and give the baby assistance with the breathing. In a severe case where the baby doesn't respond, then we may have to put in what we call a breathing tube into the baby's airway, into the trachea or the windpipe, to help the baby to breathe. A lot of times babies will just respond with stimulation, or sometimes you may see us put a mask over the baby's nose and mouth and just giving pressure or flow of air to help keep the lungs expanded by giving the baby something called CPAP. Anytime that we hear that a baby has apnea, or we see it if we're at delivery, or we get a call from the nurse, from the nursery to let us know, we are definitely going to admit these babies to the NICU, because we need to monitor these babies closely, we need to treat, and we need to try to figure out why the baby is having this apnea. So how do we treat it? We take the baby down to the NICU. We're going to put the baby, like what we call leads on the baby's chest that look like little stickers, and it's basically connected to a machine or a screen that lets us look at the baby's heart rate, look at the baby's breathing rate, and look at the baby's oxygen saturation. And if there's a drop in the oxygen, a drop in the heart rate, or one of those long pauses in the breathing, then the alarm goes off to the monitor and it triggers an alarm so that we know to go and check on the baby. So for babies who are those late preterm babies who may have that immature breathing reflex, sometimes what we can do is give them a medication called caffeine. So just like in adults, to get their morning started, they need that jolt, they need their caffeine, they drink coffee. Same concept, in that we know that when we give babies a medication called caffeine, it can stimulate the breathing center and sort of trigger and help the baby with the breathing. And this can last in the system for a few days. So other babies who are coming in with apnea, sometimes they, again, like I mentioned, may need that breathing support. So we'll put them on CPAP or some other type of flow of oxygen to help the baby to breathe more comfortably. And we then do some additional labs and tests to figure out maybe why the baby has apnea, if it's not due to being exposed to either magnesium or pain meds for mom, or if it's not a baby who was born early. So one of the things that we'll do is, again, look for infection. So we'll do a CBC, where we look at the white blood cell count, and we'll do a blood culture, which goes to the lab, and we wait to see if it's going to be growing any bacteria in the blood to let us know if the baby is infected. If there's anything concerning that looks like infection, then we'll put the baby on antibiotics. Another thing that we'll do is called a blood gas, because that gives us information how well the baby is breathing. So when we breathe, again, we breathe in oxygen and we blow off CO2. So when we do this blood gas, we look at the pH and we look at the CO2, and those numbers help us know how well the baby is breathing. And it also has something that's called a base deficit, which is only important because if there's a large amount of acid in the blood, then that number will be elevated, and that triggers us to know that maybe we need to look and see again if the baby's enzymes in the blood are working properly, because sometimes this may be a sign that there's a metabolic disorder going on, and so we need to look at that a little bit more closely. Something else that we might do is we might do an ultrasound of the brain, which is a picture of the brain where we look and see if there's any bleeding in the brain that might explain this apnea. Or sometimes we do another study looking at the brain called an MRI, which gives us a more detailed picture of the brain to look for any signs or injury that might explain this as well. Again, in a baby who's having these events and we don't really have an explanation, then we kind of do a more further workup. We might call the cardiology or the heart doctor to do an echo, where they do a picture and they look at the heart and make sure that everything is functioning normally there. If the baby is having any tremors or jerking movements that might be suggestive of seizures, then the baby may need an EEG, which is the way that we test for seizures in a baby. And then again, we may need to, if there's something going on with the baby's airway, then sometimes we need help by specialist doctors like the ear, nose, and throat doctor or the plastic surgeon to evaluate the airway and see if something else is going on there. So you're like, okay, I know what apnea is. I know that my baby's going to the NICU. I know what you're going to do to treat and test. When can my baby go home? So again, in most of these common situations where it's a late preterm baby or baby's been exposed to medications or something like that, most of these cases, the apnea will resolve in 2 or 3 days. And so your baby will need to go a full 2 days without having any pauses in the breathing, any drops in the heart rate, or any drops in the oxygen before they can go home. They will have to be off of all breathing support for at least a day, doing well. And if they're doing all of that, then we know that they're ready to go home. Again, in these cases, this is just either related to exposure to medications or being a little bit premature. So once this issue is resolved, this is not something that you need to worry about going home. The baby doesn't need to go home on a monitor, and this isn't something that's going to affect the baby's development later. If it's something, again, more serious, where the baby is either having seizures, or there's maybe bleeding in the brain, or there's an anatomical issue in the airway, then that's a different situation. Those babies will need to be in the hospital for longer and may need, additional workup, and their outcome is going to depend on what their particular diagnosis is. But for the majority of these babies, they're going to resolve their apnea within 2 or 3 days, and then they are going to be able to go home. So this is a quick talk on what is apnea. Thank you for tuning in. Please go onto Facebook and Twitter, type in @Dr. Launice MD, and follow me on social media to keep in touch. Check out my other videos and leave any comments if there's things that you would like me to talk about. So thanks for tuning in. See you next time.